Hi, we're the Belfast Trust COVID-19 ICU Follow Up Clinic, and we were set up rapidly in response to the pandemic to assess and aid the recovery of patients who'd had COVID-19 who were treated in the Belfast Trust. Central to our service is our wide-ranging multidisciplinary team.
We have an excellent physiotherapy team who assess recovery and ongoing rehabilitation needs.
All patients are seen by a clinical psychologist. We're there to normalise the experiences of distress and anxiety that are part of the patient experience and the wider community experience at this time. But it's also important to remember that there can be ongoing issues with anxiety and increased risks of trauma symptoms moving forward. So we will be there to provide ongoing support as required.
The patients are seen by an ICU consultant and nurse who assess their medical needs and requirements for referrals or an ongoing investigation. They also help them revisit the experience and events of ICU, helping to remember what happened to them during what is described as a confusing and frightening time.
So at the clinic, the patients will have a full medication review to ensure the medicines are safe and effective. And we'll also discuss any concerns and really just to check and make sure the medicines are appropriate for their stage of recovery.
Patients can be ventilated for a prolonged period of time with COVID-19 and can experience ongoing issues with their voice or swallow.
Significant weight loss, poor appetite and taste changes are some of the effects following an intensive care stay that can affect your recovery. The dietitian will advise on how to get the nutrition you need.
The feedback from our service has been overwhelmingly positive, with most patients stating that they got great benefit in helping them to cope with their ICU stay from the clinic.
Hi, my name is Jack McCullough. I took COVID-19 back in March. I spent 2 weeks in ICU within the Belfast Trust, sedated and ventilated, and then a week on recovery ward before eventually getting home in the middle of April to my family. One of the big things or questions that we had after that was, what happens next? Is there anything that I should be aware of? What, if any, other conditions am I likely to experience? And that's where the ICU Follow Up Clinic was a big help. Before going to the clinic, there was a whole range of tests that were done through the GP and through going for x-rays and so on. So when you got to the clinic, they had all the information that they needed. You've seen a whole range of specialists covering physio, pharmacy, speech, language, dietitian. Everything was covered in that one session, and all of our answers were basically all the questions that we had that we were looking answers for were covered. The big thing that I would say from a takeaway is that, from a good news perspective, is that I am strong, I'm healthy, I don't seem to have any other symptoms or any other lasting conditions. So there are some good news stories out there regarding COVID-19.
As we enter a second wave, we're setting up our clinic on the Knockbracken site so that we can continue to help and support these patients who've suffered from COVID-19.